Time now 6:36. 3 states now account for about 1/5 of the world's new cases of COVID-19. Texas is one of them. Almost 1 in 5 new cases worldwide are coming from Texas, Florida, or California. That is according to new numbers from NBC News. Now, Monday alone, more than 25,000 cases were reported in those 3 states combined. With all of this morning, the increase in cases right here in North Texas is not only keeping local hospital staff busy, but also local emergency medical technicians and first responders. COVID-19 related calls have doubled in a month's time, and those EMTs have become a vital part of the equation to keep hospitals from crisis capacity issues. Here's our Larry Collins.
From MedStar in Fort Worth,
help is on the way.
The calls don't stop.
And the past 14 days, has she been in contact with someone with suspected or confirmed coronavirus?
Right now, they're averaging 70 calls a day for patients with COVID-19 related symptoms.
Back in the beginning of June, we were down to maybe 30, 35. But those numbers have essentially doubled currently, and there have been some days that we've been at 110, 120. It's been a little bit of a roller coaster for us and for most EMS agencies in the healthcare system across the country over the course of the last several months.
It's like trying to put a puzzle together with the pieces and the puzzle constantly changing.
And now we're really concerned, okay, this is our surge. Are we ready for it?
MedStar started planning for increased volume and what-if scenarios back in March. Luckily, they weren't needed.
But we've dusted those plans off now because it looks like we might actually need it here in the near future.
If hospital capacity hits crisis level, they would be called on.
But what if hospitals had to start moving patients from one facility to another because of overload? What if we had to start using non-traditional settings for ambulances and for inpatient settings?
But they also play a vital role in offering services out of the hospitals, helping to keep emergency rooms from overflow issues.
So if a patient has a coronavirus-related symptom and they are stable, their blood pressure is good, their breathing is good, we don't bring those folks to the hospital.
We also need to talk about personal protective equipment. They say that PPE has become very expensive because of demand. But there's one trend they've noticed nationwide, and that is a shortage of medical-grade gowns. They say some agencies have had to resort to using inexpensive rain ponchos for protection. Larry Collins, NBC5.
Larry, thank you. July and August are traditionally the busiest months for North Texas medics. They are already averaging 15 to 20 heat-related calls a day, and traffic accidents rise during the summer as well. All of this puts a strain on agencies who are dealing with COVID-19 calls.